Technology and AI
Hmm.
are rapidly changing healthcare. Yes or no?
The changes that excite me the most are the ease of it. You can use AI for like having the solutions or like brainstorming ideas.
Most people think healthcare means becoming a doctor or becoming a dentist.
There is a conditioning that we have, like we need to have one engineer and one doctor in the family. Until and unless I was researching about it, I did not know that there was a corporate side to health administration as well. You have healthcare administrators, epidemiologists, coordinators, practice managers. There are so many fields around it. You are just ripping the band-aid off. There is something that is causing the scar as well. How will you stop the scar?
It might be in the future, but it's not going to be easily for an AI model to just swap or take the job of a doctor. Hi guys, welcome back to another KapsTalks episode. Today we have Tanisha.
Hi guys.
Thank you so much for being here. Tanisha, I know her personally. She's a really good friend of mine. But apart from this, she has been in this health field for quite a long time. This podcast is mainly to uncover all the points related to the topics, which she will tell you eventually. Wait. But just for a brief intro, if you can just introduce yourself, what you are, what you do, and then we'll go forward.
Hi guys, I'm Tanisha. I have a bachelor's in dentistry. I'm a dentist. And I recently started my Masters of Health Administration in La Trobe University, Australia. And that's about my educational qualifications. So I'm very new to this country.
When did you land here?
I came like end of April, like 30th April, 4 days before my classes. My class was on 4th of May. So yeah, fresh off the block.
And she is one of the strongest friends mutual.
Yeah.
So I know her apart from like that sense as well. But anyway, you might see her face in my vlogs as well, just in case if you know we post vlogs and stuff. So Tanisha has been in this health field. You were a dentist and now you are studying
Health
health
administration.
administration.
So
Paperwork?
no. So if
If you can define health administration.
if you don't know what is health administration, which usually people don't go by because these are just fancy names. So it is just a MBA in health. It's like if you have done your MBBS, your BDS, or you are a doctor in any of the countries, what you can do here is public health and health administration. Usually people take public health. Why? Because it is the most like renowned field or the most spoken about. When I was researching about it, I saw that health administration is also a field. Because if you want to do marketing and in health, why do public health when you have to gain the experience and then go to a place? I'm being like really optimistic about it. But yeah, I know that experience counts a lot for it. But if you have a backup to it, like if you have a master's degree to it, you know the things. They don't have to teach you. And it's like, I know the administration. I know how administration works. I know how the things will go on if I get into it. So it is basically all the administration work that happens in health. If you don't want to go to the clinical side of it, just go into the corporate side of it.
If you don't want to cut,
Yeah.
then do the paperwork.
Yeah.
Simple terms.
Yeah.
I didn't know it. I was like, okay, I'm not going to do biology because I don't like people to have blood and all stuff.
I love it though.
You love it?
Yeah.
I mean, you have been a dentist, you said.
Yes.
Can you brief some about your dentist past?
Yes, it was like dentistry just came to me by destiny. I could say that. I was planning on doing the MBBS part of it because I'm a Grey's Anatomy fan. So I always wanted to be an oral surgeon. Although I always envisioned myself for a person who does not have a personal life and all her life is into the clinical part and stuff like that. But something like happened before my NEET exam and I was not into the zone to give the exam, although I was preparing for it and I scored really good in the mock tests and stuff, but I did not score good. I could have gotten a private MBBS admission, but I thought let's do BDS. And I think that it has been the best decision ever because it is the perfect life balance. like work-life balance, you have it. You work just 9 to 5. There are no emergencies. Even if there are emergencies, they are very short term. Like you have shorter appointments and stuff like that. And it is like, it is an art. You have to like, we need to check the 1 mm things of teeth. It's like you just wear loops and everything just zooms out. You don't see the world. You just have one teeth to look after, and you're doing everything around it, and it's a clean field. Although people always ask me, how do you put your hands in people's mouth? Don't you like have the ick for it? Things like that. But it's like, yeah, it's just a clean
Just
field.
get the habit of it.
Yeah.
I mean, I still don't like wisdom tooth. Still coming out, slow by slow. Okay. Well, coming on to things, most people think healthcare means becoming a doctor or becoming a dentist. What made you realize that there was a much bigger world beyond this clinical practice and you end up going into administration?
I think for us, like specifically if we are talking about us Indians, there is a conditioning that we have. Like we need to have one engineer and one doctor in the family. It is a
Another
taboo.
stereotype, yes.
Yeah, it is a stereotype. And until and unless I was researching about it, I did not know that there was a corporate side to health administration as well, because I always thought that the marketing people are the only ones that work in healthcare administration. But when you go further into it, you get to know that there are so many fields around it. You have healthcare administrators, epidemiologists, coordinators, practice managers, stuff like that. And you can skip the work life, the workplace, whatever experience you can get, and you can just jump into that specific field to get the job. If you're like, there are so many people who don't like the corporate life of IT, but they like it of administration. Like in my class, there are so many people who have worked in business and stuff like that, but they switched to healthcare administration just because they wanted something with the balance of it, which had some human virtue as well, but it does not involve direct contact with humans as well. So
Indirectly.
yeah.
We're working behind the scenes, not on floor, but not when I say not on floor means not in the IC, not in the four walls, but still.
Yeah, exactly.
Looking back in the time, what actually inspired you to be in the healthcare field? Don't say that only the stereotype. Was there any other relation, or was it just the stereotype you went into?
It's like, I have a reductionist thinking in terms of healthcare. I never thought of being anything else other than this. I've always been attracted to healthcare, and it was like, yeah, I'll do this only. I was never like, कभी और कोई चीज इतनी भाई नहीं, मतलब कि yeah, there was nothing that attracted me the way that healthcare did. It was like, yeah, it was my road to walk on, and I think I've walked on it flawlessly.
Still walking.
Yeah, still walking, and I hope I run. But yeah.
Do you want to run? Well, you want to be a specialist or kind of, but you're not in the clinical side. So what's the high grounds you can go in this administration part? Just for the roles, what kind of roles come out?
If you talk about hospitals and stuff like that, the CEOs are the work in the healthcare administration. You go starting from practice manager at a specific field, then a state lead, then let's say for Australia, you become a practice manager of an organization. You go ahead. You become like a leader of a certain suburb. Then you go to statewide. Then it's like that. So the progression here is also the same. It is that currently the people who have more experience in it are switching their jobs from clinical to administrative side. Why? Because the people in the administrative side are usually doctors, and they want to clear their exams, AMCs, ADCs and stuff like that. And the people who usually start as, let's say, assistants, receptionists and stuff like that, and they're keen on having the growth, they go forward to it. But if you are in administration, you can go to that level. That level, from what I know and from what I've researched, all day I just do this. How can I do this? How can I do this? That's the thing. It's just you need to be motivated towards it. You need to find things. You need to work towards it.
Just for the knowledge purpose, can you explain a little bit for my personal knowledge in this management of health applications or
Yeah, health administration.
health administration? What do they teach? Okay.
System thinkings, digital health, advanced practice. It's basically how how healthcare works. What is the healthcare quality of it? How systems think. What are wicked problems? All of the health problems are wicked problems. Obesity, diabetes, any heart diseases. These all are wicked problems. We don't have the solutions to it. We are just using solutions that are just symptomatic solutions we are using. We don't have a fixed solution to it. That's why we need more healthcare administrators who can zoom in and zoom out of the problem whenever they want. So what we learn is, apart from the clinical side of it, they want people from the background that have been working in the healthcare field, that are used to the clinical side of it, but who can zoom out of the problem and think of a bigger picture. So I think my field in dentistry, I was closer to the basic level of it. And if I'm doing administration, I know what is going on at the root level.
Okay. Makes sense. If I'll compare for the lame language, a manager knows that in the marketing team, who's doing the content creation, who's doing the script writing, how they're doing it. So you're kind of a manager, and doctors directly, not under you, directly connected to you, and they're working on flow, and they're sending you the reports, and then you take care of it.
Yeah.
And then it keeps on, hierarchy keeps on going up.
Yeah.
And there will be someone at the top, or the top ones at the hierarchy, where they're mainly focusing on things that are totally responsible to keep a hospital running, and so. Makes sense. Because I have someone in connection. He's in a hospital. He works in telecommunication field. So not him. There's so many people who are engineers who work on how the telephone lines work across all the rooms, canteens, and everything.
Yeah.
So now I'm getting it. So that's more like a telecommunication. So when people think hospital, they usually see, okay, only doctors.
Yes.
Nah, there's so many things happening at the same time.
You could just say that doctors are actors. Doctors are the ones that you see on screen. You don't see the directors, the producers, the spot boys, the lighters in a setup.
In the movie.
Yeah.
Okay.
That's it.
Makes sense.
Yeah.
You work directly with patients before moving into this healthcare management system as a dentist. Was there a moment that actually changed how you viewed healthcare? Like, okay, now I learned this is not me as a dentist. This is not actually the reality. There's so many things going on. Or do you know it now?
It was like when we had our 4th year of dentistry and our internship, we have a subject called public health dentistry. And the college I did my dentistry from, it was a public hospital, like a charitable hospital. And we had a 45-day posting, and we used to do dental camps around. I did my bachelor's from Ludhiana, and we carried out dental camps around different factories and stuff like that. And it was when we went there, and you see there that people don't care about their dental health. They don't want to spend any penny of it until unless a tooth is aching, and all they know is that we need to take it out. Yeah.
Okay.
There are 100 ways.
Now you're talking
Yeah.
straight up.
So it was you go there, you provide the education for it. Although there are 7 fields of dentistry, 7 branches of dentistry that we have at a hospital, that we have at 50 rupees for extraction, but still people don't want to come because they're not aware of it. So still we had the public health department to spread the awareness and things like that. And then that's when it came to my mind that you are just doing you are just ripping the band-aid off. There is something that is causing the scar as well. How will you stop the scar? How will you do that? Plus, I think there is a little compartmentalization of healthcare system back in our country. Although there are so many people working towards it, but it's like we need to learn a little from the developed countries. One, why? Because they have lesser population.
Okay.
Second, they have been independent since long, and they know how, although we have achieved what we could, the maximum in healthcare in the years that we could, but it's like if we could borrow some knowledge from the neighboring countries, why not?
I agree.
Yeah. So it was like, yeah, they have a better healthcare system. They have everything segmented out. So why not study there? Why not get the information from there?
Already talking like a manager.
No, yeah. That was a compliment. So I
Yeah,
take
it is.
it.
Talking about the neighbor developed countries, Australia has one of the world's most respected healthcare system.
Yes.
When you landed here, when you started studying, what surprised you what surprised you most after you started your studies in here?
I'll talk about study and workplace as well.
Do you have the workplace experience?
Yes.
How?
When I came here, I was like, I don't want to go anywhere. It was like, I have always done things at home and I was always working, so I could not sit free. Like, not the work in sense of getting money or something, but yeah. So it was like I started applying for jobs, this and that and this and that and this and that, but I did not have any experience. But I was too stubborn that I need to work in a dental field only. Why? Because one, I have the experience for it, and second, if I want to go into healthcare management, I would like to go into dentistry. So when I landed a job as a dental assistant, so one thing that was like back in India, we always call doctor this, sir, ma'am, sir, ma'am, sir, ma'am. It looks like you are respecting it, but here it is like they have a different personal and professional life. They could be scolding you professionally, but then personally they will have no grudge, which I never experienced back there, because I think there is a ego clash back there, because yep, maybe. Although I've had the professors who were the best in the fields and they did not have anything like that, but it's like it's a culture here. The people there have different conditioning. Also, it's like I love the dental field back there. I love everything. Even when we met, I told you that I want to go back. I don't like it here. But it's like the work culture is very like softened. It's like they'll churn you out professionally, but personally they'll also ask you how you are.
Makes sense.
And I love the first name basis thing.
So I mean,
yeah.
you're saying they're not in their own bubble of having a high class job or a low class job.
Yes.
They're like, even if you're a CEO or even if I'm a small designer in a company or a small dentist, we're still the same humans.
Yeah.
We can sit together and have coffee and we can have same communication level. That I agree with you. Yes, I learned it. And what about the study part? What did you see in the study?
I don't like the study part a lot. I had a class today. It was like, I don't know, like the teacher or the way that she taught, but it's like you have some favorite professors or yeah.
Professor Snape, Professor Dumbledore.
It's the same, but it's like I love the professors who have a discussion with you, open discussion with you, because like I'm doing healthcare administration. If I won't talk about the problems that we are having or the things like that, so it varies from class to class, subject to subject, professor to professor. There were subjects that I loved. Why? Because of the discussions we had in class. We were like, yes, it's Monday, we want to go to the class and stuff like that. But there are classes, no, she'll bore us off and things like that. Because here, the study is softened, it's not as hard. it's
Depends on how you manage it, yes.
yeah, how you manage it and stuff like that. But yeah, I've studied a lot harder. And yeah, it's okay.
In Australia, what I've learned till now, and after doing so many podcasts with so many people, in Australia, study is not hard. It's more like the teachers, the lecturers are not strict. They have a certain standards. You need to meet those standards by performing at least minimum level in your assignments, and then they will give you like fine. But if you're not able to do the minimum levels, then they might talk to you personally or have your details written. You have experienced both India and Australia in healthcare. What does each country do well in healthcare according to you, and what can they learn from each other?
I think that you get like whatever time is it, you get the treatment back in India. They have quick responses, quick treatment options, variety of dental treatments, and I think in fraction of prices. What I feel is it's like the suppliers are selling the same things at a lesser price back in India and a more price here, just to meet the standards and stuff like that. And I think that dental treatments here are not that affordable.
Yeah,
and healthcare as well.
I agree. Especially dentists, taking dental operations as example. I have seen ample of examples. People not doing their health surgeries in Australia. Rather, they would prefer to go back to maybe India or some other nations to do the health. Especially even if it's a simple, even if it's a simple wisdom tooth removal, they still would recommend to go back to India, spend lesser money. In 1,500 rupees, you can do it, and here it would be $1,500, which is almost 1 lakh rupees. That's a small example, but you have, sorry.
Yeah,
Sarah.
no, it's true. Also, it's like they have expensive treatments back in India as well, like implants and stuff like that. But still, it's a fraction of price here in Australia. It's not a problem with the dental field in Australia. It's like the stuff they have. They also need to make margin off of it.
Raw materials.
Yeah, the raw materials are far more expensive. And even though in India, we had a senior who had like a whole supply chain of instruments. They had the best instruments. Everybody in India mainly uses those instruments. But it was like, yeah, it's still affordable because we needed to get our own instruments. But yeah, and the thing that India could learn from Australia is that India does not let, like I have so many software developer friends who want to make a dental software. Like in Australia, you go to a dental clinic, they have different dental software.
Yes.
Every clinic works with a different dental software. They don't put the energy into it. In India, they pay a person and still they are doing it by paper. Some of them have switched to the softwares, but it is clinic-wide. They don't have it like for an area and stuff like that. And I think that they need to be more open to the dental softwares because, you know, technology is coming.
So you're saying in simple words, cheap and cost efficient raw material is something that Australia can learn from India, and India can learn from Australia, which is technological advancements, even on the base level, even not using. Makes sense. But the thing is, it also depends on when you're taking India as an example, because I came from the same nation. There can be someone in a suburb or someone in a village sitting and only able to understand the things that are written on the paper. Rather, the person also has to have a touchscreen smartphone to see a report which is made by an iPad. So that's more like
Yes. What I was like, that is a fair point. But what I was saying is not for the patients. The patients are internally for the dental clinic, for the administration part of it, because they are lagging behind on the administration part. They want to hire more dentists, but not the more administration. They want to. They need to have dental assistants. India needs more sterilization protocols. Although when you go to a private clinic, they will have the best. It's like a taboo that they don't have a good sterilization procedure. No, they have. It varies from dentist to dentists. Even if we were not provided with like cleaners or things like that. We knew that we have a patient. Like when you work in a dental hospital, you don't have always the best supplies, even though you pay for it. But in all the countries worldwide. But it's like you need to care for your patient. And we used to bring our own set of gloves and clean wipes. And we used to autoclave our instruments because we cared for the patient.
Yeah.
Yeah. So,
You're putting really good points, being honest. I have done so many podcasts, but this is somewhere, especially in the medical field, I don't want to perform. I want to learn. You're putting good points. So kudos to that. Technology and AI are rapidly changing healthcare. Yes or no?
yeah.
Which changes excite you the most and which changes concern you the most?
The
Let's
changes,
talk as a manager.
the changes that excite me the most are the ease of it. You cannot, it's like, yes, you can use AI for like having the solutions or like brainstorming ideas in a fair point of sense. It's good to have a tool rather than spending your brain off the whole night thinking about solutions. Having different treatment options, you just put in an information and think about it, because all the things that AI has are the informations that have been stored all around the world.
APIs.
Yeah, all the articles that have been in the world, all the case studies that have been in the world. You cannot do that in a single night. It helps you categorize them.
Yeah.
Yeah, it helps you get resources. Where it frightens me is that if you follow it step by step. But from what I've learned, dentists don't do that, or doctors don't do that. They have all the resources around them, and then they go through it and check if it is because things on paper and in practical are like sometimes really opposite.
Yeah.
But the thing that reassures me about it is that dentists and doctors still have the empathy towards the patients. And I think that is because the way that they get into healthcare. Until and unless the part is wiped off, then it creates problems.
And no, it's not going to be.
Yeah.
It might be in the future, but it's not going to be easily for an AI model to just swap or take the job of a doctor.
Yeah.
At least for now.
Yeah.
That's good. I don't know. Okay. Studying while working in healthcare, it's not easy. I agree with it. What has been the biggest challenge for you as a student, because we have been in the study field, and how did you cope up with it?
I have a little easier study pattern. Like we have,
in the course.
Yeah,
Okay.
because I scheduled all my classes on a single day for a term, like let's say Monday. But the problem that I'm having is that it is a very accelerated study plan. I don't have the vacation in between 1 week. I'll do like 2 subjects and then it will be like I have just 1 week of vacations. But like still, if I had to do 3 days of like separate classes and then 3 days of work, because I'm allowed to do like 24 hours, which usually 8, 3 days it covers usually. But currently I'm having like a good study and work balance. But yeah, when I started to work, it was like really exhausting because they churn you out. They don't give you like, they have the breaks, obviously. But working is very difficult. Do I have to say that?
It's up to you. If you don't want, it's fine. We can.
No. But yeah, I work at like a good place, and I recently switched from it to a better place. But yeah, it's like
it's too much.
But then the place I am at now are very good. Although there is a taboo like you should not work for desis and stuff like that. But I think that the people who are educated, they just care for you, and being in the same cultural environment, it might raise opinions on your podcast, but it's like I work with dentists. All the people who are assistants or practice manager there, they were dentists from back India, or from back Philippines or Kenya or countries like that, and they are like, yeah, they're welcoming. and they know that you are on the same. I think they're educated and they're well at their life to be not envious of you because you're just starting out your career and they are at a good level. So I've met like good people now, but yeah.
You're trying to clean it up. Little bit.
No, like yeah, the first job I had, it was like very hard. I went there for a few days and it was like they were like, I don't want to like be a racist or something, but they were not Indians, not Australians, but they were like, I could not sit for a single minute, could not sit. Half-hour break I had, it was like in between patients, somebody swabbed me out just so that I could have my lunch. And then I had to come back. And the pay that they were paying was minimum wage. I only worked because I wanted to start
I know. I get it.
and get an experience. But yeah.
It's fine.
But yeah, now and
It's all experience. You learn, right?
yeah, I learn. And it's like now I talk to many people and I told them I switched to this place and I just went there and I just went there for 2 days, like the place I'm starting at. And I was like, yeah, you don't want me to do more work? More work? They said, take a breath. You did so much. I was like, I did not even do anything. And it's like, yeah, touch wood. And all the people have said that they have a good chain of like, they have, I think, 100+ chains around Australia. And I think that's why their administration is so good, because they zoomed out on the problem and they have so much of patience. Why? Because the workers are happy.
Yeah. Smart. Okay, so if we can brief simple words, if someone wants to start building a career in healthcare management in Australia, let's see, wherever he comes from, whichever country, Pakistan, Bangladesh, America, UK, where should they start? If you can just brief this, and then we're going to be ending it.
What I think is you should start first from placements that your university offers. It usually starts from after the first semester. Whatever subjects you're having, go. Ask your teacher. The teachers are very helpful. Professors are very helpful. If they like your point, if you're good in discussions, you will get placements from there. Even if you're not getting a job in your field in Australia, if you have placements, they will count as a work ex. You can go
unpaid placements. Unpaid placements.
Yeah.
Okay.
I think because then you get to the career hub. You go to the conferences. I have a few friends who are specializing in digital health and they're on conference right now in Sydney. And I think you need to make connections. If you are the one that stands out of the group, obviously you will have people to talk about. If you can yap to them about it.
Don't yap, talk.
Yeah, talk sense. I think then, yes, you can get it, but you will need to start somewhere. So even if it, like for me, even if it was at a dental assistant position, I need experience. No job is a small job. You cannot straight up, like, if I am a dental assistant, I cannot say that I will do the MHA and I'll be the practice manager of a place. No, they will not give me. I need to be at the root level to raise it up. And I think this is a good approach. Because how will I manage a full organization if I have not worked in it? If I don't know the problems of the people, if I don't know what dentists are going through, what dental assistants are going through. So yeah.
Because worst comes worst, they can back off, but you being as a manager, you can't back off. You have responsibility. Even if it's 1 a.m. at the night,
yes,
you need to get up and fix it up because the hospital is waiting for you. I agree with her totally, because I have people in this healthcare industry and I have seen them working very hard. I mean, pay is good at the night time if you work, but still, 20 years from now, I need a brief intro, like brief answer for this. It's fine. We can talk about it next one, because I have something waiting for you here, which I didn't get you in the email. 20 years from now, where do you see yourself?
If you ask me by my heart, working part-time and sipping mimosas by the beach, part-time.
I mean, work-wise, I was saying.
Yeah, but yeah, I'll cover both parts of it.
Healthcare field, yeah.
But yeah, I don't want to switch from healthcare to anything because I've had so many suggestions from people that I should shift my field to get PR. I even tried for it, but then I talked to my dad and I was like, I'm not feeling it, Papa. And he was like, come back. And I said, I don't want to come back because I want to try about it. And he asked me the same question, what do you want? Like down the line, 20 years. And I was like, I want to manage something. It's like, I have this instinct. I want to manage an organization. I want to speak. I want to be a speaker at some place. I want to share my experiences. And I want to be at a managerial level.
At that time, I will call you again for the podcast.
Yeah, I hope so.
I will.
Yeah, and I'm optimistic about it. I'm optimistic about it. And I know that if I manifest it, I will get there. Yeah.
Okay, so thank you for all the answers. Let's do one thing which I didn't mention. Let's do a rapid fire round.
Oh, yeah. Oh,
Australia or India?
India, all the way.
Public or private healthcare?
Private healthcare.
Coffee before class or after class?
No coffee.
What do you like?
Hot chocolate, sometimes middle of the night.
Leadership or clinical practice?
Clinical practice.
Hospital or community health?
Community health.
One healthcare myth.
That doctors earn a heck a lot more than they say.
But it's not true.
No.
AI, opportunity or threat?
Opportunity.
One habit every healthcare professional should develop.
Infection control.
One book everyone should read. Who's in the field?
I don't read books, but I read the occasional magazines that you have. You should have a subscription of it and you should read as they come.
So that's what's happening biologically, advancements in the world. Okay.
And the case studies that are emerging new.
Describe healthcare in one word.
Passion.
Okay. Being really honest, I learned a different perspective of how things work and how studies are going on in the world. Okay. And I personally, if someone can give me a chance, I would want to reshift my field to healthcare. Two reasons. First, it doesn't look that much tough. It might be tough. Second, you can earn a good amount at it.
Myth.
And not as the doctors. I was saying in the managing field.
Yes,
but
you can.
Unless if I can do the full-time podcast, why not?
I hope you do. I hope I meet you in a full-time podcast and we are at the level.
That's I hope. I'm trying it. So yeah, I would love to share your LinkedIn and your other, if you want to, like any contact, Instagram or anything, if you are okay with it, in the description, so that if they have students or anyone has any question or any points, they can reach out to you if you're okay with it. And if you're not, it's fine.
No. Reach out.
And if you want another part with her for any topics related to healthcare, or if you want to deep dive into the study area, let us know in comment section. We can make part 2. And we will bring hot chocolate for her again.
Thank you.
This is Caps with Tanisha. See you guys in the next podcast and subscribe to the channel for more podcasts.
Bye, guys.